Well, here we see these reassuring reductions in cases we've been watching from the United States and the United Kingdom. A little bit of levelling off there in the UK. United States, there were some data issues here, but it's still going down. But then we look at this graphic here, and this actually shows the number of positive cases, the share of daily COVID-19 tests that are positive. And although we see a nice continued reduction in the UK, we see quite a sharp kick up in the United States there. So this does indicate that there's more community spread going on here, as indicated by the increased positivity in testing. And of course, the suspicion has to be that this is an effect of the new variants in the United States, which of course is a concern. So welcome to today's talk. We're actually running quite late today. It's still Tuesday the 16th, but you'll probably be watching this on Wednesday the 17th of March. While we're on the states here, let's look at some data first. Thinking about the United States, 54,639 new cases per day was the average over the past 7 days. So we do see a reduction. That was the average increase over the past 7 days. And of course, this results in well over 29 million confirmed cases. But last week, the 7-day rolling average, the average per day was 61,538 cases per day. So there's no question there. We are looking at a good reduction in the number of new cases per day in the United States. And deaths has been high for a long time in the States, and it's still 702 deaths was the last 24 hours, so 533,000 deaths in the States. Just a terrible, tragic number of deaths. Now, getting on to better news for the States, the vaccinations. So at least one dose, at least one dose, 72,000 people have had at least one dose. 21.7% of the entire population, And of course, young people aren't under the age of 18 aren't currently being vaccinated. Fully vaccinated, 39 million, and of course these are always about 24 hours late by the time we get them from the website for the Centres for Disease Control. Anyway, that works out at 11.8% of the total population. Total shots given 110 million. Now, do click on this because that's what I was going to show you before. This is the daily count of total doses administered and reported to the Centres for Disease Control. So we can see a really gratifying ramp up in the numbers of vaccines being given out per day. And here we see we are over the 2 million vaccines per day in terms of 7-day rolling average. Now, this is an impressive ramp up in cases. This really is. We didn't anticipate it, but it's still immensely gratifying to see that increasing number of daily cases. So and it's only going to keep going up. I don't think there's any question about that. It's an impressive vaccination program going on. So do click on that for yourself. Vaccination trends. Now, interesting to note the vaccines being given in the States. So Pfizer and Moderna pretty well neck and neck there. Pretty self-explanatory really. Johnson & Johnson kicking in, 1.5 million doses given already for the Janssen vaccine, single dose of course. And I think we can... so that will be one of these 3 vaccines. It's just that they don't know which one it was at the bottom there, because these are the only 3 vaccines being administered in the States. So that's what we see. Pfizer BioNTech and Moderna National Institutes of Health kind of neck and neck. This will be increasing in proportion, I have no doubt, pretty soon. Hospitalizations in the States. I've put the website there. I haven't got it ready to click on, but they are continuing to go down in quite a gratifying way. So click on that for yourself by all means. Now, it's just a matter of time until children are going to need to be vaccinated. A lot of people don't like the idea, but even if all adults, even if it was just over the age of 16 are vaccinated, there is sufficient children, young people in any country to keep the vaccine, not to keep the vaccine, to keep the virus prevalent. And of course that would spread it on to older people as well. So it's just a matter of time till children need to be vaccinated, no question about that. And Moderna has started a research project, the Kid Cove study. It's in phase 2/3 clinical trials now. They're in the process of recruiting 6,750 children to take part. Now, this mRNA-1273, this is the Moderna vaccine we're using. So this is the same Moderna vaccine as we just looked at in that data shot there. It's the same. It's the same one. Exactly the same vaccine. Same vaccine code. So looking for safety and efficacy, of course, in children. They want to know if it protects children between the ages of 6 months and 6 years from getting sick. So it looks like the thinking, at least in Moderna, is that the vaccination could well be given at 6 months of age, potentially on a population scale in the not too distant future. Prevents COVID-19 disease and SARS coronavirus 2 infection in children is the question. That's what they're going to be looking at. And they say this is crucial public health tool to help curb the pandemic. So yes, it will prevent some disease in children, but thankfully minimal. But it is going to be needed, otherwise children are going to become a chronic reservoir of the virus and keep infecting adults, which of course we don't want. And the placebo in this trial, 50-50, so half of these are going to be placebo, half are going to be the vaccine. And the placebo is salt water, not another type of vaccine as it was in the Oxford AstraZeneca trial. Nothing wrong with that, just a different approach. So 6,750 children currently being vaccinated to prevent infection and to monitor safety and efficacy. A lot of people don't like it, but it has to come. And of course, childhood vaccinations, we do millions of them. All children are vaccinated against a whole range of diseases. Now, it's not funny, I was going to skip this today, but this debacle about the Oxford AstraZeneca vaccine in Europe, quite a few Europeans, a lot of Europeans who were booked in for the vaccine today, it's been cancelled. There's a lot of anger. There's a lot of accusations being thrown around. It's generating a lot of heat. People are saying this is politically motivated. Let's look at what we know. 17 countries, I think, now have suspended the Oxford AstraZeneca vaccine. That list is probably not, it's not complete. There's a few more. But I mean, notice the countries here. So Denmark, Norway, Germany, Italy, France, Spain, Sweden, Netherlands, large population countries. The implications of this are huge. Now, 11 million people in the UK have received the vaccine, 17 million over Europe. As far as we know, 37 people have complained of reported blood clots. That's 0.00021% of the people that have been vaccinated. So 37 people have complained of blood clots. From that population size in general over this period of time, we'd expect about 200. So from this data, it looks like vaccine is protecting against blood clots, from what we know. Now, of course, I'm not claiming that. I don't think anyone is claiming that. We can assume that is somewhat underreported. But where this is coming from is just a complete mystery. So it works out. Let's just suppose that this vaccine was causing these blood clots. Now, we don't think, as far as I understand from public domain data, there is no increased risk of blood clots in people that are vaccinated with the Oxford AstraZeneca, as opposed to people that are vaccinated with the Pfizer or the Moderna, as opposed to people that aren't vaccinated. In fact, there's some indication here there might be a reduced chance. We'll see why that might be in a minute. But let's suppose that this complication was real, that it was causing blood clots. Well, if I got this infection, my chances of dying are probably about 1 in, depends what data set you look at, say 1 in 200, 1 in 300, younger people, less of course. Now, if someone says to me, look, there's a 1 in 200 chance, a 0.5%, or even if it's only 1 in 400, a 0.25% chance that you'll be dead in a month, I'd think, I'd rather not take that risk if I can avoid it. But the chances of an individual developing blood clots, if we assume that these 37 people did develop blood clots as a direct result of the vaccine, which of course we don't believe they did, that would be 1 chance in 297,297. So would I rather take the sort of 1 chance in, say, 400 of me dying if I get the disease, or would I rather take 1 chance in 297,297? Well, it's a pretty short debate, isn't it? I would go for that one. That's assuming that the vaccine causes blood clots, which of course we believe it doesn't. So it really is quite strange what's going on here. And we have covered this in more detail, so I'm going to scoot through it. I don't want to get bogged down in this. I've got interesting things to do today. But this lady, Executive Director of the European Medicines Agency, no indication at present AstraZeneca vaccine has caused blood clots, so it doesn't seem to be causing blood clots. Pfizer and Moderna appear to be linked to similar number of blood clots. So why have all these countries stopped the Oxford AstraZeneca? Thailand has reinstigated it. The Prime Minister, today I'm boosting confidence for the general public as he's the first person in the country to take the Oxford AstraZeneca vaccine as the rollout starts in Thailand. Congratulations, sir. Excellent. Now, normally we don't approve of politicians pushing in, but this, of course, is a superb public example to the population of Thailand. So, the mystery deepens. Now, as far as we know, the European Medicines Agency are having a bit of a meeting, shall we say, with the World Health Organization on Thursday. So we're expecting a definitive statement then. So I would expect all these countries that have suspended the Oxford AstraZeneca vaccine to be starting it again on Friday, I would hope. But some have suspended it for longer. And it's hard to see how public confidence will not have been somewhat eroded, even although I can see no reason for that in the public domain. Now, just very briefly here, COVID-19 and thrombosis. COVID-19 and thrombosis, what do we know about the risks of treatment? So this is from this paper, British Medical Journal, check it out. Cytokines cause the liver to produce more clotting factors, so the blood becomes stickier, more likely to clot. Thrombosis is definitely contributing to the high mortality rate from COVID-19. So part of COVID-19 is blood clotting. So from this, it would indicate you're much more likely to get a blood clot if you're not vaccinated. So it's definitely contributing to the high mortality rate from COVID-19, as well as the other problems. Not only can it lead to a pulmonary embolism, as we looked at in great detail yesterday with diagrams, which can be fatal, but there are also high rates of strokes and heart attacks in COVID-19 disease. And yet, these governments have stopped COVID-19 vaccine. Very, very strange. We will know more on Thursday. I'm not going to talk about it till Thursday, till we know more. Right, Office for National Statistics in the UK. Very interesting data coming out here. I think I'm a bit zoomed in today. Let me just go out a bit. There we go. Office for National Statistics. Infectious diseases deaths highest for over a century in England and Wales. So more people are dying from infectious disease in 2020 than in any time for over 100 years. 143,000 COVID deaths certificated. Now, I've used the certificated number. I know it's higher than the deaths within 28 days of a positive test. This is more likely to be accurate. And this is also how the historical data was recorded for comparison, so it makes sense to use it. 2020, 73,500 registered in England and Wales for 2020. So that was the number of COVID deaths, England and Wales 2020, plus another 4,400 from other infectious diseases. Now, this is defined as infectious diseases. Many more people than that would have died of bacterial infection, but they're counting this as specific transmissible diseases. COVID-19 was the underlying cause of more deaths in 2020 than any other infectious and parasitic disease since 1918. So 1918 was the last time before 2020, 102 years, when more people died of infectious or parasitic disease. 1918, there was 89,000 deaths from various infectious and parasitic diseases, and of course this was when the great influenza pandemic was raging. So 1918, grand total of deaths there, 89,900. Smaller population then, of course, so percentage-wise it's larger. 2020, 73,500. 2007, there was a bit of a blip due to the peak of Clostridium Difficile, which is a rather unpleasant bacterial infection of the gastrointestinal tract that was very prevalent in hospitals at the time. Now, this graph here really is quite poignant. Let's have a look at this from the Office for National Statistics. So here we have the number of deaths registered due to infectious and parasitic diseases. This is, I hope you can see that there, that's 1901, 1910, 1920, 2020 all the way through. And gratifyingly, we see the number of infectious and parasitic diseases go down from 1901 all the way through to 1960, and still a gradual decline even after 1960. And that, of course, was the influenza pandemic there, 1918, 1919, that killed so many people globally. That was the Clostridium difficile's blip, and there we have the COVID-19 deaths. So really one heck of a spike there from COVID-19 deaths. And if we kind of trace that line across roughly like that, and then trace that down, we see that it's the highest number of deaths since 1918. So there you go. Highest number of deaths from infectious diseases in England and Wales for 102 years. That is the significance of this pandemic. Now, coming up to date, England and Wales prevalence figures. 6th of March, weekending 6th of March, always a delay. Infections, just over 200,000, 0.37% of the community population. This Office for National Statistics data is excluding hospitals and prisons and other institutions. So 200,000 that week. The week before it had been 250,000. So quite a gratifying fall from 248,100 down to 200,600 in the 7 days. So good reduction in that 7 days to the week ending the 6th of March. Weekend in the 6th of March, that equaled 1 in 270 of the population of England and Wales. This is lower than the week ending the 27th of February 2021, when 248,100 people, 0.5%, were estimated to have COVID-19 in England. So, yep, good reduction. Now, the southeast and southwest regions of England, possible slight increases in cases in this week up to the 6th of March. So as we see, it's not quite uniform over the country. So southeast of England, southeast and southwest regions of England, possible slight increases. North, east, northwest, East Midlands, east of England and London decreasing rates. So they're kind of going up a little bit, not a lot, and they were going down more. So patchy over the country, as of course we've seen, but different areas. I mean, there was a time when London was way up, and it's been varying, which isn't really surprising. You would expect these kind of fluctuations. England and Wales deaths, week ending the 26th of February, slightly longer delay in death reporting, of course. Deaths 2,105 in that week, 18.2% of all deaths. And that was the fewest deaths since the 6th of November 2020. So although there's still 2,105 people dying in the week, that was the lowest since November 2020. So the direction is good, but the numbers are still ticking up. It's still a substantial number of deaths. Now, better news again. A bit of a roller coaster today, going from not so good news to better news. And antibodies to COVID-19, 3rd of March, for the 28 days leading up to the 3rd of March. So basically the month ending the 3rd of March. So these are antibodies to COVID-19 from antibody blood studies. And of course, antibodies can be there as a result of infection or vaccination. The test does not differentiate between whether the antibodies are there as a result of the infection or as a result of vaccination. So antibody levels risen in every UK county. England, antibody positive, 15.6 million people estimated to be COVID-19, SARS coronavirus 2 antibody positive. And that's now 34.6% of the population aged 16 and over. So that is coming up quite nicely. Now, the real figures, of course, will be higher than this because people that were infected in the first wave will have lost their antibodies now. So even though they'll still be immune as a result of their memory cells, they won't be showing up on this. So that means we can expect a degree of immunity from antibodies and memory cells, such as memory T cells and memory B cells, of actually well over 34.6%. I would suspect, I don't want to guess, over 40% anyway, for sure. Because some people will be infected, produce antibodies, have lost the antibodies, but still have the immunity. So that's kind of minimum numbers. So what can we say? 44, 45% maybe of people now have a level of immunity. It's coming on well. Wales, it was 30.5%. Northern Ireland, it was 31.2%. Scotland, it was 22.3%. Now, here's the data for England. So what we have here is, this is based on a study of 996,000 people, 22.3%. Oh no, sorry, that's Scotland. This is the next thing here. Ignore that. That was Scotland. We've done that. Move on. So this is the graph for England, right? So what we have is age here, 1625 through to 85. And this is the percentages. And of course we see, now these lines here are the error bars. They're the 95% confidence limits. So we see that in the say 75-year-old age group where it seems to be highest, about 90% now have antibodies. And of course, as the vaccination program continues, that will start moving out to that kind of shape like that. And then as it continues, it will start moving out to that kind of shape like that as the older age groups get vaccinated. So this is a remarkably encouraging graph, remarkably encouraging trend. And what they've done here is they've taken samples and extrapolated that to the whole population of England. And I've put the link there for the Office of National Statistics site. Look at it and check in your area if you want. Now, Germany and France, all sorts of political things happening. There's a lot of unrest. Nice, for example, strange things, France. It seems to be very regionalised. Nice seems to be locked down fairly strictly, but Paris, fewer restrictions, 6 p.m. curfew. Bars, restaurants, gyms closed, but shops and schools open. So this is why the cases, unfortunately, are going up in France. And we know there's a high prevalence of the new variant as well. So Paris relatively open despite having double the rate, we believe, of infections of Nice. And as we know, Michel Macron has announced the suspension of the AstraZeneca on the 15th of March. Same with Angela Merkel in Germany. This folie à deux that seems to have gone around Europe, this follow after you, I don't know what's going on there. Doesn't make too much sense. But we do know that intensive care is saturated in Paris, and people are being transported to other parts of France for intensive care. Jordan, civil unrest, all sorts of problems. After partly upset because 7 patients died after a hospital ran out of oxygen, which of course is terrible. It has been rectified now, but a lot of unrest. A lot of people need their daily income, and you can understand why they're protesting about the lockdown measures, because they need their daily income, and yet Jordan could do with getting rid of the pandemic. And Brazil, another country we've followed closely, health minister is now a cardiologist rather than the former soldier who was that's the fourth new health minister we've seen in Brazil since the start of the pandemic. So let's hope things are improving there, and we do expect them to be. He's making some encouraging noises already. Okay, so we'll know about this. We should know about this vaccine debacle fairly definitively on Thursday. Let's hope it's promising, and it really is quite grieving, the number of people that are going to die as a result of this delay. Yeah, it really is a pity. In the UK, of course, we're carrying on quite happily with Pfizer, Oxford AstraZeneca, and of course we've just started. In fact, I think we're just starting this week with the Moderna as well. I haven't heard it in the papers yet, I haven't read it yet, but I think it will be this week as well, so that's encouraging. Okay, that is us for today. Thank you, of course, as always, for watching.